According to the American Heart Association, more than 5 million Americans are diagnosed with heart valve disease every year. In today's HealthCast, we take a look at the results of a study into a less invasive approach to replacing the main artery to the heart.
Despite his best efforts to stay healthy, Joseph Krinsky has suffered with heart problems for over 3 decades.
My first problem was when I was 45. I had a heart attack.
A year ago, he was diagnosed with aortic stenosis, a life-threatening condition that can lead to heart failure and increase the risk of sudden death. Doctors at Mount Sinai Hospital determined Joseph was a candidate for a clinical trial involving a transcatheter approach to surgery.
Decreases the size of the surgery. The patient doesn't need to go on bypass at the time, and most of these people are able to go home by 3 days after the surgery.
The core valve models itself to the patient's own aortic valve.
This is a stent, essentially, with a valve sewn in. So we put it inside the valve that the patient's born with, and then as it expands, it takes over the function of that valve.
Joseph was out of the hospital in 2 days and back on a treadmill within a week.
I can do anything. Almost anything.
The core valve study focused on what we call high-risk patients, those who might not survive an open heart procedure. The study showed that the transcatheter approach reduced the risk of dying from surgery by 25%. In my view, catheter-based cardiac procedures will soon be found to be superior to standard open heart surgery for many patients. With your second opinion, I'm Dr. Ari Soffer.
Future studies may focus on the benefit of transcatheter valve replacement in younger, lower-risk patients. If you have a health-related question or concern for Dr. Soffer, you can send him an email to askdrsoffer@local10.com.
That's all for Local